how do I manage diabetes? When maybe the routine that you had that was working isn't there. Perhaps you're experiencing changes in your eating because food is so accessible and maybe is pleasurable or provides stress management. And maybe you feel a little bit disconnected from your healthcare provider. And so there are some challenges here, and I'd like to kind of walk us through this a little bit. So what is the role of your provider? And, we know that the way we really try to promote diabetes care is that the provider is there to understand you and to provide you a safe place to kind of adjust to your diabetes, to really adapt to the tasks of self-management. We see this, we call it a change-based relationship where the provider's there to support you. And then to manage the specific aspects of diabetes. Blood glucose is of course the central aspect of diabetes management, and then the medication dose escalation. And so, this is good news, isn't it? But really, when you think about it, have you ever felt that what the clinician says is more important than what you think? Have you ever felt that your clinician is judging you? You ever felt like going into the diabetes clinic or seeing your physician is like being a kid being called into the principal's office? And we know that, in fact, this is a very common experience that people have. People very commonly tell us this. And so it is great. I'm not criticizing the diabetes care provider. I work inside the diabetes care world, and I understand the value of that. But I'd like to suggest that maybe we've got an opportunity. And let me elaborate on that. So my question for you is COVID an opportunity for you to play a bit more of a role? And so here you see this kind of relationship. Who's the most important person in the room? Are you? Or where the clinician is kind of there to meet your needs? Or do you sometimes feel that, you're kind of the lesser importance? And what's really interesting about diabetes now is that the telehealth is bringing the doctor into your home. It's bringing the clinician into your home. So rather than you going out to the doctor and the diabetes management sort of existing outside of your home, there's a really interesting opportunity here where that diabetes kind of exists now inside your home. And I think that has some potential. So what is it that you could do in that context? Now that we're really taking advantage of what we call telemedicine, and everything tells us that people will continue to access telemedicine after COVID. If you have to drive 90 minutes to get to an appointment, maybe you don't want all of your appointments to be in person. Maybe you're going to prefer to have a telehealth session so that you don't have to do that driving. And that gives you the opportunity really to kind of become, in a way, the leader of the team. And so as the leader of the team, what is it that you need to do? And I'm a diabetes psychologist, I guess. And so I can tell you that really as a person living with diabetes, the tasks are really somehow coming to terms with your disease so that it's okay to have it, okay enough that you don't ignore it. So we call that disease acceptance. That you're okay with the treatments that you're on, the medications, the insulins, and that you're actually prepared to do what you need to do to control your glucose levels. And so disease acceptance, treatment acceptance, and adherence, those are really the work of diabetes management. And I think we have some interesting opportunities now. And so I'd like to talk about each of these quickly and show you a way that you can sort of understand where you are now, and that will help you to figure out where to go next. So let's talk about disease acceptance. What does that actually mean? Well, these two questions can be really helpful. How serious do you view diabetes to be in your life? And it has to be kind of serious enough that you will want to take care of it. Your motivation is based on the extent that there's a problem. If your house doesn't need a new roof, you're not motivated to put a new roof on your house. But if you realize that the roof is leaking and it's going to damage the walls, and this is a problem, this is serious, then you're going to have the motivation to do something about it. And how much personal responsibility do you have for managing diabetes? And if we ask these questions not from a critical way, but from a non-judgmental way, then you can see what that does, is that you can see high and low seriousness, high and low personal responsibility. And the person who says, this is an important problem that I need to do something about, we call those people accepting. But maybe you think it's serious, but I don't have any role in it, so I just have to wait for my doctor. You're kind of passive. If it's low seriousness but high responsibility, then you're kind of uncertain. I know I have something to do, but I'm not quite sure what's wrong with my sugars being above level X. I'm not quite so sure if that's a big deal. I know my doctor said something about it, but I'm not really clear on it. So we call that uncertain, or low, and low is indifferent. And this is not judgmental language. This is descriptive language. And what I really like about, and what I actually do in my clinical practice most of the time, is I work with the uncertain, indifferent, and passive people, and helping them to figure out, okay, how do we increase the seriousness? How do we increase the sense of personal responsibility? It's a very useful way of understanding your behavior, and then that helps you with your needs. So if you're in the uncertain condition, you might say, okay, can you guys tell me, what's the big deal here? Why is this so serious? Because I know you say I should do it, but I am not quite so convinced. Tell me. And so it becomes really a way that you can direct your care. Now let's talk about treatment acceptance. Wow, doesn't this look similar? And in treatment acceptance is based on, again, you can see this with two questions. And those questions are perceived need and perceived concern. To what extent do you need to do X? Do you need to take insulin? Do you need to take injectables? Do you need to take more medication to control your blood sugars? And your judgment on that is important. To what extent do you have concerns about achieving this control? What are your concerns about medications? What are your concerns about self-testing? And those, again, are high and low. And then you can categorize the person who has high perceived need and low concern is accepting. The person with high need and high concern is ambivalent. The person with low perceived need and low concern, I don't have any problem with it, but I don't see the need for it, is indifferent. And the person with high concerns and low needs is a skeptical person. And that's important to understand. So again, this becomes a starting point. And so if you reflect on your own behavior, then that will help you to figure out where you are. And wherever you are is perfectly acceptable. And diabetes management, when you think about it from incorporating the psychological aspects of diabetes, is really very much about this. Okay, now let's talk about really the adherence piece. And so this is really about readiness to do the work. And this is really where blood glucose is so important, because we know diabetes is really a glucose regulatory problem. And so glucose is really the important aspect of it. And the assumption that we make, and it's actually generally true, is that you can't control what you can't measure. And let me just illustrate that to you. You're on the highway, you're driving at 120 kilometers an hour, and you've been on the highway for an hour and a half. You now exit the highway, and you're going to go through a school zone where the speed limit is 40 kilometers. Now, imagine getting from 120 kilometers, where you've been for 2 hours, so you're kind of pretty comfortable at that speed, down to 40 without a speedometer. By the time you get to 90, you're thinking that, hang on, I kind of feel like a turtle here. By the time you get to 70, you're worried that this guy's going to pass you. But you're still 30 kilometers above the speed limit, but you feel like you're crawling because it's all relative to where you were. How do you know it's 40? You have to have the meter. Well, I'd like to suggest to you that blood glucose monitoring should be exactly the same thing as speed monitoring in a car. It's just giving us a measure. And so this is potentially important, and let me explain why. The reason it's important is because you don't judge the speedometer. If you look down and you say, oh, I'm supposed to be driving 50, I'm driving 90, there's a cop car ahead of me, I think I'm going to slow down because I'm too fast. What happened in diabetes, for some unfortunate reason, is that we brought in the judgment. And so, you know, why did we ever decide to call it testing? Because what happens when you take a test? Well, we all know what happens when you take a test. You either pass or you fail. So all of a sudden, this judgmental language gets introduced into diabetes. And when it happens, because nobody can be in control of their sugars all of the time, there's so many factors that influence any particular reading of blood glucose that it's not directly under your behavior. There's lots of things that you can do to have a positive effect on your behavior, but the moment-to-moment change is something that is not always under your control. And what happens with this pass-fail, of course, is that diabetes kind of feels like this. And if you've ever had this experience, this is not a good way to really manage. So we have an opportunity, and I'd like to elaborate a bit on that. This is a recent publication that has actually shown that telehealth can actually be really, really effective. And so, again, what we're starting to see is that I think you're going to find that the ability to invite your clinicians into your home so that they're supporting you, not you going into their clinic. I think this shift that the pandemic has kind of forced upon us actually has the potential to be really valuable to supporting the diabetes self-management. So thank you very much for your attention. I hope you found this useful.